If sugar does not cause diabetes, then what causes diabetes? Diabetes is a condition that causes your blood sugar level to become too high. We have different types of diabetes. The type 1 diabetes, often diagnosed in childhood, although it can occur at any age. This type cannot be prevented. It is usually genetic. Then we have the type 2 diabetic, which is usually predisposed by ethnicity, age, obesity, and overweight. It can be prevented or even stopped with lifestyle modification and treatment. We have the gestational diabetes, which happens during pregnancy and usually resolves when the child is born or when the placenta is separated. There are other types of diabetes, medication-induced diabetes caused by steroids. We also have the diabetic syndrome. Stay tuned for more. Please remember to share this video. Thank you. How do I know when I'm developing diabetes? The first sign of diabetes is excessive thirst. So as you feel thirsty, you drink a lot of water, and because you are drinking a lot of water, you go to the toilet every time to wee. As you wee, you begin to lose some body fluid and body mass. The person begins to lose some weight. And as you lose weight, you become very tired, become very lethargic and fatigued. And sometimes diabetes comes with feeling of vomiting, nausea. So you don't want to drink, and yet you are losing a lot of fluid, you are urinating a lot. So as a result, the person loses weight. The person is always tired. And then some people, when they have wound, it doesn't heal at all, or is very slow in healing. Some people will have recurrent urinary tract infection, that the one we call toilet infection, water infection. And so those are the major signs of early onset. So today we'll be mentioning how to prevent diabetes and some of the complications that comes with uncontrolled blood sugar. So as we said earlier on, eating sugar is not the cause of diabetes, but diabetes happens when there is problem with the insulin. Maybe the insulin is not enough, or it's not working, or it's not even there at all. So when that happens, any little amount of sugar you take begins to circulate in the bloodstream. And the different types of diabetes requires different management. Like the type 1 has no prevention. So it's an autoimmune condition. They usually take insulin for life. The type 2 can be prevented by lifestyle modification, regular exercise, weight loss, and regular check. And it's usually managed with either with insulin or tablets or with diet alone. The gestational diabetes is usually managed with tablets